The town of Coventry, Rhode Island presents the Coventry Substance Abuse Prevention Task Force video series. We're working together for a healthy community.
Thank you all for taking the opportunity to watch this video. You are one step closer to being a better citizen and taking care of another person in the community by watching this. By way of introduction, my name is P Zabbo. I'm one of the emergency medicine physicians here at Kent County Hospital in Warwick, Rhode Island. We are in the middle of a public health disaster. The opioid overdose epidemic is real. And it is real here in the state of Rhode Island. The overdose death rate due to opiates in Rhode Island is significantly worse than the U.S. average. In 2014, we ranked 6th, almost leading the nation in overdose deaths. There were close to 250 deaths due to opiate-related opiate overdoses in 2014, and that number continues to climb. The data lags behind because the investigations usually take some time, but we anticipate that number to unfortunately be approaching close to 300 over the next year. The questions then become is, where do we go from here? The police department, the Coventry Police Department, local outreach groups, you're going to hear from a lot of people today. And there's many ways to get involved and things to know, so I'll try to keep this brief. This is a disease, and it's safe to call it a disease because that's what it is, addiction. This affects groups across all socioeconomic classes. There is no one immune from the opiate addiction crisis that we're facing. All of you at some point or another will know someone personally or collegially that has a problem with opiates. So the first issue is really recognition. How do we recognize that somebody has a problem or is starting to get a problem? And this can start, as you'll hear, at a very, very young age, going down to the elementary school age, 8, 10-year-olds, where we see developing addictions to pain medications. This is something that we really look to the parents to take an active role. Parents, caregivers, caretakers, and teachers. How do we recognize that there's a change in a child? So things that we look for would be things, do they have a new group of friends? Is their personality different? Do we notice that they're sleepy during the day, they're irritable at other times? Unfortunately, these symptoms, overlap with many, many other processes, including just being a teenager in itself. But the most important thing is parents and caretakers really just being there, knowing where your children are, who they're hanging out with, where they are after school. You really need to have a presence. And this is something I think that all of us should be talking to our children and students about. This isn't something that we want to hide and keep in the back. This is something that we need to bring to the front lines and educate the children about that. There are injuries that happen to people, but when we look at how people become addicted, one of the number one reasons is because they've been on a pain medication for an injury or a disease process that affected them as a young person. The goal really is, when people have pain, yes, we do need to treat their pain, but I think physicians and parents and caretakers really need to be educated about the potential risks of addiction. We need to respect pain. Pain is the body's response to an injury, and sometimes it's okay to have a little bit of pain. We don't want anybody to be in anguish or severe distress, but if physicians now are withholding many, many more narcotic pain medications because of the abuse potential and the addiction potential, we at the American College of Emergency Physicians, nationally and here in Rhode Island, have enacted prescribing restrictions through the emergency departments, where for acute injuries, we're not prescribing more than a 3-day supply for acute traumatic injuries in an attempt to reduce that potential for abuse and addiction. To go from there, again, recognition and involvement in education is the number one thing. When we get, beyond that, the police department has spoken about Narcan, which, if you think about it, it is the antidote to an overdose, an opiate overdose. This medication is safe, and it has been approved for public use. And by that, I mean you can purchase this prescription at various local pharmacies without a prescription. And so I encourage everybody who knows somebody who's on chronic pain medication or knows somebody that has an opiate addiction, this is a medication that you should have on you, in your car, at your home, so that you're able to be there in case of an overdose. Again, this is available without a prescription. We administer this, unfortunately, daily, numerous times in the emergency department. It is administered daily by the police department as well. This is something that we need to get out into the community, and it is life-saving. But that's what it does, and it saves a life. But we need to do something more after that, and that's really where you'll hear from our addiction treatment centers that will talk shortly. Where do we go once we do save that life? And that is the biggest thing. We are seeing on a daily basis countless overdoses coming into the emergency department, and thankfully we are able to save many of them, but as you have heard, we're doing poorly at saving all of them, as we are one of the leading states in the country for our overdose deaths. So I would encourage you to investigate Narcan if you know somebody who has an addiction, if you know somebody who's just on chronic pain medications. And I encourage everybody to keep an open mind. Again, this is a disease that affects all classes, all groups. There's no barrier to who it can affect. So I encourage you to get in touch with your local community. We're available at the hospital for questions. I would entertain any questions.
The Coventry, Rhode Island Substance Abuse Prevention Task Force would like to thank the following speakers who have contributed to this video series. For additional information and guidance regarding substance abuse prevention and treatment, please contact the following resources.